Think you need to be in the US or Europe to get top-notch medical care? Think again. Expats from around the world are choosing Panama for its high-quality, affordable health care. But is it really as good as they say, or is there a catch? Today, we're pulling back the curtain with Dr. Charles Coates, a seasoned general practitioner in Panama. Our panel of real expats is going to ask probing questions to separate fact from fiction. We'll be asking questions like, is private insurance necessary, or can you go completely out of pocket? What's the real deal with prescription drugs and medical procedures? Are they affordable, or are expats getting ripped off? And of course, the big question, would we trust Panama's healthcare system with our lives? This conversation is raw, unfiltered, and packed with real insider secrets expats like you need to know before making the move. If healthcare is holding you back from moving abroad, you can't afford to miss this episode. Stay tuned. Welcome to the Panama Podcast, from dreaming to doing. I'm your host, Melissa Darnay. If you want insider tips on living, investing, and having a blast in Panama, go to choosepanama.com and snag your free copy of Panama Uncorked. Welcome to another installment of the Real Expats of Panama, a segment of the Panama Podcast where we cut through the noise and bring you the real scoop on what life in Panama is actually like. We're here to give you the unfiltered truth, because when it comes to living in Panama, what you don't know could cost you. Joining me are two powerhouse co-hosts who know Panama inside and out. Stacy Jenks is our vacation property management expert, and Amanda Gleason is a turnkey decorator. Our special guest today is Dr. Charles Coates of ProCare Clinic in Panama City. We're here to give you the unfiltered truth, because when it comes to living in Panama, what you don't know could cost you. Before we get started, welcome to the show. Cheers!
Cheers! Welcome.
Cheers. Thank you for joining us.
Hey, thank you for having me in today.
We appreciate it. We know that doctors are always busy.
He is the second doctor that we've had, but only the first one that's shown up. The first one had emergency surgery, so we're so happy he's here. Dr. Charles, tell us a bit about your background. Where did you go to undergrad? Where did you go to medical school? Tell us all about you.
Sure. So, hey, first of all, thank you for having me here today. My name is Dr. Charles Coates. I'm a primary care physician. I was born and raised here in Panama. I did my undergrad at LSU in Baton Rouge, Louisiana. There you go.
Louisiana.
So I lived in Baton Rouge for about 5 years, and then I moved back to Panama, where I did med school here at Universidad Latina. I've been in practice now for about 5 years, and my primary focus is preventive medicine and primary care.
And you have something unusual in that you're more of a concierge doctor.
Well, yes. A lot of patients, they refer to that. I really don't have, or my practice doesn't focus on concierge.
One of the things that separates Panamanian doctors from doctors in the U.S. is that the next day you always follow up with a WhatsApp.
This is crazy. I was like, why are they messaging me?
I know. You know, something very crazy is, since I started practicing, I've been seeing a lot of, expats. Usually at the end of my consults, I'm like, hey, here's my phone number in case you need, WhatsApp me.
Yeah, like, what?
If you need anything, any emergency. You're like, wait,
Okay, yeah.
You mean the clinic number or or your private number?
Exactly.
I'm like, no, this is my private number. So
Yeah, that's not normal.
Do you have a theory on why, I guess, the medical culture in Panama has developed in such a different way? Considering most of the doctors are US trained, why is the medical culture so different in how you approach
So
patients? Do you
personal.
have a theory?
So much more personal.
So push.
That's a very good question. I think all comes down to family. I think us Latinos here in
That makes
Panama,
sense. Yeah.
like we're very family oriented.
Yes.
And that's the way I see my practice. Is, like, I like to see patients. I like them to feel comfortable. Like, patients like to be listened, get to the primary diagnosis. And then after that, it's like, okay, I want to know, or I want to follow up with you. I want to know how you feel next day. And I think that's something where you build that bond or that relationship with patients. In the States, it's a bit different. You know, you're more of a number.
Yeah.
Definitely more commercial.
It's more like,
You
hey,
get 5 minutes of time with the doctor. It's
TikTok.
exactly.
talk fast.
And the thing is, in this, I know this because
And there's no follow-up. What's up?
Yeah, there's no follow-up whatsoever in the U.S. unless
know.
you're dying.
I know. Or go to the emergency room.
Right, right.
They'll contact me there. So, you know, I think that's the beauty of Panama is that, you know, you have that one-on-one communication with your primary care or with your doctor. And, you know, he's available if you have any questions or so. You know, I get calls at 9 p.m., 10 p.m., 1 a.m.
And you respond. So, and I know the answer to this
Yes.
because I go to the clinic. But however, what is your typical response time? If someone reaches out, do they have to wait a month to be seen?
No.
No?
So I think, well, in our case, you know, at ProCare Clinic is where, you know, my clinic, you know, we try to see patients at least when they book 24 hours. We try to see them that same day.
That's crazy.
Can you even imagine 24 hours?
So, you know, we try to see them that same day or, you know, 24 hours afterwards, you know. But just to give you a background, with ProCare Clinic, it's me and my partner, Dr. Alejandro Contreras. You know, he's right now in Cleveland. He's doing a rotation over there.
Freezing.
Yeah. Actually, I talked to him this morning. He's like, man, it's so cold. I'm like, it's so hot here in Panama right now.
Try taking a Latino and putting them in the snow.
No.
So, you know, we're both fully bilingual. So, you know, we kind of, you know, we're both there for our patients, you know, and we both try to see at least 10 or 11 patients a day. So, you know, we close at 5:30, but we're always there like around 7:30, 8 p.m., you know, trying to get all patients covered up for the day. Same thing, you know, we have a huge network of bilingual physicians here in Panama. So we have like a big network where we can get, you know, if you have to see a cardiologist, if you have to see an orthopedic surgeon, if you have to see a nephrologist, urologist, we already have a network where we can contact them and get patients to be seen quicker and not have that, you know, waiting time.
And the lab is 2 minutes from your door.
Yeah, it is. It is.
I remember you sent me for some tests and you said, no, they'll be back in 20 minutes. And I'm like,
Yeah, right.
Yes.
without fail, 20 minutes later, I'm sitting in the waiting room. Ding, there's my email with my results.
Yeah, isn't that amazing?
Yeah.
You know, we talked about, you know, what we call concierge medicine because you say you see, you know, 10, 11, 12 people. I think the average doctor in the US might see 50 or 60 or 80 people a day. And it's hard to have a personal relationship when you're seeing that many patients. But as the patient, I really appreciate the time that you spend with us. And I'm actually a patient of his partner's.
Yes.
So, you know, the fact that he's taken so much time to talk about things is much appreciated. But aside from the time, let's talk about the quality of care. How would you say, because you've done medicine in the US, now in Panama, what do you think the difference is?
Okay, so I think the difference or the primary thing is that patients are heard here in Panama. So,
Agreed.
You know, what I've seen or what I can compare from the US is that, you know, as soon as you walk into the consult, you know, the first thing we start is, you know, knowing a little bit about you. You know, first kind of like breaking the ice and kind of, you know, knowing the patient first, talking to him, you know, asking where you're from, where, you know, how did you get to Panama? And then we started, you know, asking more medical
Well, I
questions.
don't look like I'm from Panama.
So, you know, it takes, I would say more or less a consult in my practice, minimum 45 minutes to an hour.
Yeah, I was shocked at the time we were given when we went for the first time. I was like, doesn't he have other patients?
You know, I think, you know, there's a saying that it takes about 15 minutes to be able to diagnose a patient. But, you know, in that 15 minutes, there's many other things you could also learn about that patient or things that the patient, you know, did not disclose at that point in time. So you kind of like break the ice, you ask the questions, and then you make the correct diagnosis or the correct treatment plan. And then, you know, I think that's the primary thing, not like rushing through the patient. I think that's the kind of like the difference between, you know, here compared to the US.
What do you think is the level of training among most doctors in Panama? Do you think most have received training in the US or Canada?
Okay, so I think it's a 50-50. You know, something very important is that Panama has a very good has very good medical schools.
Okay.
You know, we're very westernized in the type of medicine we learn here in Panama. Something I always tell, or something that we focus on a lot here in medical school, is that it's very hands-on. You know, here since you're in your second year of med school, you're going to hospitals, you're seeing patients, you're touching patients, you're asking questions. So you get a lot of practice since a very early age in medicine. Then after you graduate, you do 2 years of internship where like literally you are the physician, and you kind of like, you treat patients, you see patients, you diagnose patients. And then your second year, you go to what we call rural, where basically they send you out the city, depending on what city you get chosen or picked to. And then there you have to practice for a full year, right?
Where did you go?
I went to Panama. So I was about an hour and 20 minutes away from the city. I was in a hospital called Aquilino Tejeda. Are you familiar with Panama? Have you
Not
been
me.
there?
I am.
You've been to
Yeah,
Panama?
because I was living in Coronado for a long time, so that's 45 minutes. Up
So
the
I
road.
used to live in Ensenada and used to drive everywhere. too.
Really
Yeah, it was like a 35-minute drive, but very enjoyable. So
easy drive.
Yeah, no
No
traffic.
traffic.
Super easy drive. Super
No
easy drive.
potholes.
A couple there and there, a couple there and there. But, answering your question, I think Panama has very good med schools. They have very good medicine. So a lot of doctors here in Panama are trained in the US and Canada, even in Europe. Not now, as years gone by, there's a lot of doctors who are going to Spain for training, or other parts of Europe, even South America. A couple of doctors have gone there. So I think it's a mixture of different parts or different countries. But at the end of the day, I think Panama, medical-wise, we're very renowned.
Agreed. And I think medical tourism is becoming bigger here.
Yes.
Definitely.
People are
Yes.
traveling from more expensive places like the United States to Panama to get things done because it's less expensive.
It is. I always get this question is, wow, how more cheap it's here in Panama than in the
Well,
US.
going into that, do you have to have insurance here, or do you think you can self-pay because it's so affordable?
I always tell patients, this is something, I get this question a lot because I see a lot of expats in my day-to-day, and they always ask me, like, should I get insurance in Panama? I always tell this question, if you can get insurance in Panama, do it. But don't drop your insurance back at home if possible. Because, first thing is first, when you come to Panama, you have to be living in Panama for a period of time before you can get insurance. Not everybody can get insurance, depending if you have any type of chronic conditions or pre-existing conditions. Sometimes your wages can be very high, or sometimes insurance companies won't even insure you or even cover you in this
What
case.
kind of conditions would be, for example, something that they wouldn't cover?
Diabetes. For example, diabetes is a condition that most insurance companies won't cover. And if they do, it's a very, very high deductible you have to pay. Hypertension can be one, some sorts of cancers, some back issues, kidney disease, things like this, which are chronic conditions. Usually insurance companies are like, we probably won't cover you. And age is a factor too. That's a big one too.
Because they'll only cover you up till 75.
Exactly.
Okay. So if you're in the US and you're on Medicare, just keep your Medicare.
Yeah.
Yes.
No, but I found a lot of rates here compared to the U.S. It was easier to pay cash than to use the deductible because the
definitely.
deductible was more than just paying paying cash.
Definitely, and it's true. When you compare prices of like consults or procedures.
For women, mammograms. I mean, it was a $500 deductible because they had to do the ultrasound.
Okay.
Whereas here it's
100.
55. It's 55 each.
You're like, is this right?
If you only need one, it's 55. So otherwise, it's 110. And if you're watching this instead of listening to it, she was, pointing to the girls.
So I've been so impressed with everything because, like you said, consultations, diagnostic tests, preventative
Imaging.
so much more cost effective.
So, Dr. Charles, if I came to you and said, okay, I'm feeling great, but I still want like a head-to-toe medical checkup, what sort of cost are you looking at and what sort of tests are you going to be running?
Okay, you want my clinic prices or like in general?
In
Both.
general.
In general. Okay, so here in Panama, for a full checkup, you could be ranging between $40 to $50 full checkup. I mean, this means an hour of consultation. Lab work, let's say, for example, you're doing a metabolic panel, which is basically very, very simple, but very precise tests we look at where we're checking, liver, we're checking kidney, we're checking sugar, cholesterol.
Let's do it all. Let's do it all. The
Yeah.
EKG.
Exactly.
I want the works.
I want the works.
I want the Rolls Royce of checkups.
The whole checkup, talking about lab work, EKG, consultation, rounding, that could be probably like around $160.
$160.
Around there.
Are you laughing at home? That's like the cost of dinner.
Yeah.
Cheers to that.
Cheers. We're all speechless.
Like, I thought you were going to come in and say something like, 300, 400.
I thought it was going to be in the thousands.
I was thinking 1,060 on the low side.
So what separates ProCare Clinic from the other clinics and hospitals and doctors in Panama?
So, ProCare Clinic is fully bilingual clinic. Since the moment you step into the clinic,
They are.
it's fully bilingual. Since, one of the parameters to work at ProCare is that you have to speak English. So, our staff is fully bilingual. All our medical practitioners there are fully bilingual. Just to give you an idea, at ProCare Clinic, we have a urologist on staff. We have 3 orthopedic surgeons on staff, one that focuses on ankle foot, another one that focuses on spine, and then the other one that focuses on knees and shoulders. Besides that, we have also a...
I'm sorry, I just had head,
Shoulders,
shoulders,
Knees and toes, knees and toes, knees and toes.
Okay, sorry, squirrel.
Besides that, we have a radiologist on staff. We have 3 nutritionists. What am I forgetting? I think that's right now I can't remember. But the thing is that everybody speaks English. So the thing is, it's very easy to be able to communicate. Like if we have to interconsult between one another, we can send the patient, for example, if we want a nutrition evaluation, we can send them to the nutritionist right there, same day, and be evaluated. If we need the urologist on staff, we could get him pretty quickly, same day or probably next day. So I think it's very, or what of the feedback I get is that it's very, I feel like I'm being cared at.
Yes.
And don't get me wrong, Panama, as I say, hospitals and other clinics is same thing.
Right.
You get a good care
Right.
for the money you invest.
If you had to pick one hospital, if you were an expat here and you had to have, hip replacement or surgery, we won't tell the hospitals what you say. If you had to pick one hospital as the best,
Where would you go?
Where would you go? Where would you send your mother?
Yeah, where would you send your mother?
Okay,
Wait, do you like your mother?
I love my mother. I love my mother.
Just making sure.
Okay, I think I would pick Paitia Hospital or Panama Clinic Hospital.
I love Panama
Panama
Clinic.
Clinic, yeah.
It's very nice.
Now, can I
Very
tell you a
nice.
funny story real quick? So I came to the clinic for the first time with Melissa. Melissa was referred by a mutual friend of all of ours. She had Dr. Alejandro's saved in her phone as Dr. Amazing. So we go to the clinic, and Melissa checks in, and they ask who she's there to see.
I
She
thought
said,
there was only one doctor there.
Yeah, she said,
And I'm like, I'm here to see the doctor. And
they were like, which
one?
doctor? She's like,
And I'm
I don't know this one.
Dr. Amazing. This is what he looks like. They're like, oh, Dr. Alejandro.
So we know his name now, but at the time we were just like, Dr. Amazing.
I'm sorry, I only have you in my phone as Dr. Charles.
Okay, moving back to medicine. Let's talk prescription meds. Are they generally easy to get in Panama? Are they cheaper? Are they more expensive? Give us the 411.
Okay, medication. That's a very good question that we get a lot too. Panama has a very broad. We have almost, I'd say, most of the medications in the States. There's a couple that we're getting in little by little, but I think first of all, cost way cheaper. Mm-hmm. That's number one. Second, pharmacies. Panama has very good pharmacies.
And many, many pharmacies everywhere.
Many pharmacies. Many
exactly.
pharmacies.
What I found extremely strange was I got a prescription. I can't even remember what it was for now. But I only needed 7. But I go to the pharmacy and she cracks open the box and she counts out 7 and gives me 7 in a little bag and here you go.
Well, it depends. So some medication can you can divide it. Others you have to, purchase the whole box.
amount, okay.
But usually you can get the amount that's prescribed. Like if you need 14 tablets, you'll get the 14 tablets. But we have very good pharmacies. We have very good stock of medication. Getting prescriptions or presenting prescriptions, there's two ways you can do it in Panama. You can take a physical prescription or you can take a digital prescription. You scan and you send the patient the prescription and they can just walk in, show it to the pharmacist, and then they'll just give it to you. The only medication you have to take a physical copy is controlled substances.
Like Tylenol with codeine.
Yeah, well, more
like ADHD medication.
Exactly.
Yes.
For example,
Okay.
methylphenidate, that's a controlled substance here in Panama. You have to have a physical prescription, and you can only buy it 30-day supplies.
If you go a day early, they say it hasn't been 30 days.
Exactly.
That
And-
sounds
But I
like
want the
personal
discount that we get
experience.
on Thursdays. We were making notes of where to get a prescription. We have a child. We have two with ADHD.
Okay.
And we were writing on the back of it where pharmacies to pick it up. We took it to the pharmacy, and because we had written on the back of it, they wouldn't accept it.
Oh yes, yes.
I didn't. That's a big no-no.
Here in Panama, any type of controlled substance, like literally the medical order can just have the name, stamp, and
Yes.
anything else. You cannot write anything on the back. You cannot write name of the pharmacy. And it has to have the molecule name, not
Yes.
the brand
name. Yes.
So what determines, I'm a little naive on this, what determines what's a controlled substance and what isn't?
So there's a category for medications or classifications for medications. Usually controlled substances are medications that can be used for other things that are not medically related. In this case, I can give you an example. For example, morphine, methylphenidate, tramadol on some occasions, any type of opioid medications. So those are medications that obviously you have to have, the patient has to be in a data bank where it happens that if you go a day earlier, they're like, no,
Nope.
you have to come back tomorrow, or you have to, come next week for that medication. So those are medications that have, there's strict vigilance for that.
Okay. But there are a lot of medications that you don't necessarily
Yes.
need to present the prescription for. You can just go get.
Exactly.
Blood pressure medication. I
Blood
was
pressure
shocked.
medication.
What?
Exactly. Blood pressure medication is one. For example, medications for diabetes, those are medications that don't have to be prescribed.
What about Ozempic?
Ooh, good question.
Hot topic. Hot topic.
It's not prescribed here in Panama. It's over the counter. You can literally walk into the pharmacy and get Ozempic.
Is it readily available? Or is it hard to come by? You got to know someone who knows someone.
Depends on the month. Depends on the month.
So
and
nowhere
and
around
you'll be like,
Thanksgiving and Christmas.
why the
What
month?
does that mean?
It depends on the demand, So, there's pharmacies that carry a lot of Ozempic. There's other pharmacies that run out very quickly of Ozempic. Right now Ozempic is a very popular
Yes.
medication worldwide.
Look at all these skinny celebrities. I mean, it's ridiculous.
Body by Ozempic.
Right.
But you know what? If it works for people, have at it.
Okay. Wrapping up, final words. Dr. Coates, for someone considering Panama but they're nervous about healthcare, what's the one piece of advice you'd give them?
Don't be scared. Panama has very good medical pharmacies and doctors who are going to take really good care of you. As I say, doctors here form very good bonds with their patients, and feel secure that you're going to be listened, you're going to be treated, and you're going to feel very comfortable while being seen by a doctor here in Panama.
Dr. Coates, if somebody wants to get in touch with you, how's the best way to get in touch with you?
Okay, you can get in touch with us by social media, WhatsApp, landline, or you can contact us through our website, which is ProCareClinicPA.com.
And we'll have that in the show notes too. So in case you didn't grab that, you can just check that out in the show notes. If you're coming to Panama, maybe you want to come to Panama just to get that full head to toe body scan to see that everything's okay.
Send the whole family. Imagine how much
Right.
money you're going to save.
I think we need to do an episode there Do you mind if we drink champagne while we do this? This
I'll do it.
Oh my goodness.
Let's all go to the doctor's office with wine and champagne.
with champagne. You're welcome to join us. We're going to have you there right with us.
Yeah, we'll take the podcast to the clinic.
To the clinic. Dr. Coates, thank you so much for joining us. It's been such a pleasure. Until next time, see you in Panama.
Thank you for having me. Cheers.
Thank you for making time.
Thank you.
So there you have it, our unfiltered take on what's really going on with healthcare in Panama. Remember, when it comes to moving abroad, what you don't know can cost you. Until next time, we'll be here bringing you the real stories of life in Panama.